Hi, I'm Joe Bernard. I'm a sports medicine physician at Core Orthopedics and part of the Exeter Hospital sports medicine team. At Core Orthopedics, we've been able to put together an excellent sports medicine team consisting of both non-surgical and surgical sports medicine providers, as well as other orthopedic specialties including foot and ankle, hand, and even joint replacement. In addition, within our Center for Orthopedics and Movement, we have other specialties that can help care for our athletes and active adults, including spine specialists, podiatry, rheumatology, neurology, and even physical therapy within our own building. In addition to musculoskeletal services, we provide other sports medicine services, including concussion care. I'm part of the concussion team that we've put together at Exeter Hospital, which consists of physicians, athletic trainers, physical therapists, occupational therapists, and speech therapy. So we see concussions from sideline through their treatment course in the office, through their rehab course, and we gradually return them to play. We also use impact testing as part of our return to play decision-making tools, and I'm a credentialed impact consultant.
My name is Dr. Benjamin Sachs. I'm an orthopedic surgeon who's double fellowship trained in sports medicine and hip preservation surgery here at Core Orthopedics. My background includes taking care of athletes in all different sports and at all different levels of competition. I've had the opportunity to take care of high school football players, to take care of college hockey players at Tufts University, and I took care of professional basketball players when I got to work with the Boston Celtics. I take care of injuries to the knees, hips, and shoulders. And my special interest is in the care of athletic hip injuries, specifically hip impingement or femoroacetabular impingement. And that's something that I've had significant experience training in and treating those patients, as well as researching and publishing on those topics and other related topics. Besides high school or college athletes, I would say I treat active patients from all age groups, and that includes injuries to the weekend warrior or even chronic conditions like hip arthritis.
So my name is Neil Clark. I'm an orthopedic surgeon here at Core Physicians. My specialty is in sports medicine. I'm subspecialized in shoulder reconstruction. I take care of patients, young athletes who have played in high school all the way to older athletes and weekend warriors. I do shoulder replacement surgeries for arthritic shoulders and fractured shoulders and trauma. So one of my passions is skiing. I am a U.S. ski team physician, so I've had the privilege of taking care of some of our Olympic athletes. I had a chance to travel to Finland and New Zealand with the team, as well as locally in Vail. Most of my time nowadays is spent taking care of my own 2 ski racers in Vermont. Having had a background in ski racing myself and having had several surgeries on my knee, I feel like I can relate from both the patient and the athlete perspective. So we also have the ability to work in the same building, which has been really helpful. We can come see our patients when they're in physical therapy to make sure that they're making progress. The therapists will come up and talk to us real time to make sure that we're applying a multimodal approach to our patients.
My name is Chris Dubie. I'm a physical therapist at Exeter Hospital for the Center of Orthopedics and Movement. As a physical therapist, typically we're working very closely with our sports medicine team, keeping constant communication with our doctors to give our patients the best chance at rehabilitating and getting them back on the field. So in physical therapy, we typically work with patients of all ages and activity level. We'll see high school athletes, we'll see people who are getting into sports for the first time as adults, people who are runners, bikers, tennis, various recreational activity. Another facet of physical therapy is that we're involved in a patient's post-op rehab and care. We're working closely with our sports medicine and orthopedics team to help bring a patient from out of the OR all the way back to doing what they need to get back to doing for their daily life.
We've been able to form relationships with many of the local high schools, as well as a lot of the sports clubs. Some of the services we provide are sideline coverage for their football games, as well as quick access to care and transition back to sports.
My name is Natalie Pollett. I am the certified athletic trainer at Raymond High School and Middle School, and this is my 4th year there. So to be an athletic trainer is a lot. We are kind of this multifaceted tool at a high school. We do anything from rehab to nutrition to injury evaluations, preventions, anything like that. Day to day, we come into the office, lots of paperwork before school ends. Once practices start, we're kind of on the clock. It starts with, rehab and then taping anything and everything that the kids need, to then just sitting and watching and kind of waiting for something to happen. We're always on edge. We are always waiting for the shoe to drop, waiting for something to happen so that we can do our job, which we are very good at. Now, when an injury happens, I like to think that they do feel comfortable and they come to us with almost anything, whether it's shin splints or their finger is dislocated.
I'm Brittany Ramsey. I'm the certified athletic trainer at Epping Middle High School, and I've been there for 3 years. Core Orthopedics and Exeter Hospital help us bridge that gap for them to actually be able to go and see someone that understands sports injuries and understands injuries for children. So our goal is that if an injury occurs and we need them to see an orthopedic, whether it's just for a simple x-ray to make sure they don't have a fracture, all the way through rehab, we now have that relationship and that bridge between the high school, middle school, and the hospital. So all luckily we have to do now is contact our contacts, and our kids are able to get in and get the help that they need. So the relationship that we now have between Core Orthopedics and the hospital and the schools, we're lucky enough to be able to work with Dr. Bernard specifically so that our kids get in quicker, but they also now have someone that they can look to in a doctor role that a lot of them have never had before. And he does a really good job of communicating with the parents and us, and that same thing bridges that gap for the kids.